notice I want all of you to do it. So breathe in. Again. That's it. Okay, and you can also do that at the end of every sentence, or the beginning of every sentence, and that can help as well. Avoid mouth breathing, and people who have asthma should be trained to do nasal breathing. And then occasionally they can do a nasal irrigation, which often helps to clear out some of the things to which they are allergic, and that can be very helpful. Now for bronchitis, colds, and coughs, a number of things you can do. Raspberry and lemon juice is good for cough and sore throat. And Andrew Thrash here at Wildwood is planning to get some red raspberry, the raspberry fruit powder, dried powder, which is quite stable. And I'm hoping he will have that available. You have to buy it in fairly large quantity. So hoping he will have that available, that we can buy it by the quart. And that is good with lemon juice for a cough and for sore throat. It's also good as a as a dentifrice. You can use it, helps in retarding caries. Parsley leaf is good for coughs, and in this area you can grow parsley almost the year round. Probably you may be able to grow it even in cold places like Minnesota. It seems to me that even in February and March, I have harvested parsley in Minnesota. And so I think it may be, it might even be harder to grow it in the South than it is in very colder, much colder climates. Feverfew has good anti-inflammatory properties and is very good, and you will find that that can be very helpful, and anti-inflammatory. It's slightly sedative. It's very good. It's in the chrysanthemum family, and so chrysanthemum tea is very good. You can find chrysanthemum tea in Oriental markets, and it's a very good mild tea, which you will enjoy as a beverage tea as well. Astragalus, it increases white blood cell number and activity, and it increases the production of interferon. Interferon is our first line of defense for fighting bacterial invasion, and you will find that to be helpful. Angelica is an antimicrobial, very good in URIs. By the way, we should use the term antimicrobial for herbs and not antibiotic, because the word antibiotic, it has a special definition, and it does not really apply to herbs. Now chickenpox. Notice the pox, these little teardrops on a rose petal. It's a nice way to express it, isn't it? The old doctors had very nice ways of expressing things, and they called it a teardrop on a rose petal. They also had a number of other very romantic sounding names. The icing cake spleen, and the, let's see, what was it, nutmeg liver. They had a number of foods also, or herbs that they used in naming diseases or conditions. I think that the old doctors must have been hungrier than we are today, because we use Latin names today, and makes it so that it's not quite so nice. Okay, handling chickenpox, and it is handling. There's very little treatment needed. Most of the time, chickenpox is going to run its course, and all you have to do is to support the patient and also handle any kind of symptoms that they have. Keep the child isolated. Don't take them to the doctor. If you suspect chickenpox, don't run down to the doctor's office with your child, because the nurse will probably meet you at the door and ask you not to come in, because she will have other people other children in the waiting room, and she does not want to start an epidemic from her office. Avoid scratching, so you keep the nails short, and at night, to prevent scratching during the night time, you may want to bind on some socks or mittens for the child, and even pin them to the clothing. Or a friend of mine actually pinned her child's hands to the sheet. And when I went in to see the child, I thought, see, that doesn't, I'm not sure that I agree with that, but then I thought, well, the American Indians used to papoose their children and put them on the back and carry them that way, and their arms were bound down by the side. And the studies that have been done on these children show that they're just as strong as other children because they're working against their restraints, gives them a lot of muscular activity and strength. And so I didn't say any more to the mother about her treatment of the socks and the pins. Neutral or warm baths for itching can be very helpful. In the bath, you can use magnesium salts such as mag sulfate. That's very good. In fact, hot baths given in the home can always be very well accepted if they have Epsom salts in the water, if the mother puts it in the water. And it's about a cupful per large bathtub. Avoid chilling and avoid excitement. If somebody comes to visit with children, the child with the chickenpox should not be socializing with the other children. Give catnip tea at night for sedation to discourage itching or scratching. Now here is a case of shingles, which can follow chickenpox. The chickenpox virus, a member of the herpes family, somehow sets up residence in portions of nerves, apparently, and lives with you the rest of your life. And under periods of stress or fatigue or other illness, they may flare up in the form of shingles. The word shingles means girdle, and that's where the shingles will usually occur, around the midsection. And here the woman has the shingles in the midsection, but she has it on both sides, which is rare, and there's a little bit on both shoulders. I got this picture off the internet. If it hadn't been very clearly labeled shingles in a very sick patient, I would probably not have believed it, because we usually teach that shingles occurs only on one side. But here is a case involving both sides, but apparently the immune system was low. Usually you'll see it something like this, in a pattern that goes down like this, following the natural dermatomes of the skin. Hot compresses or hot baths are very good. Charcoal compresses at night, white willow bark for discomfort that they may have. Some people have shingles and don't have any discomfort. They simply have a little stinging in the blisters, and that's about it. Valerian for sleep. Valerian root is a very good sleep producer, and almost no side effects. Capsaicin cream for the post-herpetic neuralgia. A lot of people where they've had the blisters will forever after that have a little neuralgia or a lot of neuralgia, especially if it occurs on the face and especially in the area of the eye and forehead. They may have pain disabling to the point that it destroys their lives. I met a pastor out in New Mexico who told me that he had not preached a sermon in 8 years since the day that he got shingles. He was retired, totally disabled. He said he had pain day and night. He went to sleep with pain, woke up with pain, that at any time he was conscious, he had pain. And it was and he had atrophy of the skin in this area where he had tried a number of types of creams and various things. I told him about the Zostrix, but he was not able to use it because it was so close to the eye that the fumes from the red pepper made it uncomfortable for his eye, and he was not able to use the Zostrix. or red